Welcome very much, Catherine Muthiani. We are looking forward to learning from you this evening. And you have heard we are learning a lot, so we know we will learn a lot as well today. Catherine is a lot of things, and one of her specialties is in the field of addiction. And she works at SAPTA, and she is an international certified addiction professional, ICAP. And Catherine, you need to tell us, one, what SAPTA means, and two, if someone wants to become like you, all these titles you have, there are more I know you haven't put here. How does one get to that? So welcome very much, Catherine. Yes.
Thank you so much, Helen. It feels nice when you seated quietly somewhere and someone is talking about you. For a moment, you're like, is that really me? So like you've heard, my name is Catherine Muthiani, an international certified addiction professional. I work at SAPTA, and SAPTA stands for Support for Addictions, Prevention and Treatment in Africa. We are one of the leading institutions in East and almost central part of Africa that offers training and related courses in matters addiction. We also collaborate, or we have collaborated with international agencies, and that is how we have been able to have opportunities of preparing Kenyans and other nationalities to get certified as addiction professionals. The certification is normally an exam which validates your knowledge and your skills and your ability to practice within the field of managing cases of substance use disorder. So yeah, that is me. Also within the professionalism of addiction counseling in Kenya and beyond, we have a society in Kenya, and encourage all of us. There is a room for everyone to become a member of it. It's called International Society for Substance Use, International Society for Substance Use Professionals. There are many chapters around the world, global chapters, but we also have the Kenyan chapter. So you can just Google and check isup.net, ISSUP.net, and you can become a global member. But once you get interested in what you'll find there, because it's fully packed with lots of information, latest research, statistics, and findings in matters addiction, then you can also come in to join in the Kenyan chapter. So many who are in the session today and others, I have been with Psychologist's Voice from the word go. I have learned a lot. Some I have really internalized, others I'm in the process of internalizing. And like the session that we had yesterday on suicide was, insightful in terms of, importance of being forthright when you're working with clients who may have suicidal ideations without beating around the bush and asking someone whether they have had any intention of killing themselves. Another session that I think I cannot forget about what I learned is when we were looking at financial management, adjusting to the financial changes. And I think when I had, having a budget of, or being in a position that you can survive about 5 months, even after you've lost your job without a struggle, and the importance of budgeting, that every coin counts. It was just a wake-up call of how, I spend money without having a budget for it. And generally, the many presentations that have been here, they have all been insightful, different approaches, from the general classroom setup to, just widening the scope and being sharpened as a helper, looking at how to adjust to change management, looking at personalities, looking at emotional intelligence. So I may not remember all of them, Helen, but I think majority of them, I have an idea of what is it that we covered. So today we shall be looking at the connection between addiction and trauma. And, you know, before I present what I have, I just want to know, and you can type in the chat or take 1 or 2 minutes to talk about, do you really think that there is a connection between the two? Is there a connection? And if there is a connection, where do they connect? Where do they link? I am waiting to see people write in the chat, or to hear people say what they think is the connection between the two.
Hi.
Hi.
Yeah, my name is Bose.
Yes, Bose.
One of the key things is that addiction itself is traumatizing. Leave
Mm-hmm.
alone the connection between it and trauma. Addiction itself, when you speak to some of these people, it is traumatizing for them to wake up knowing that they have to face a new day. And they know that the craving is going to come, and they have to do something about that craving. A lot of them would like to break loose, but the craving is so strong that they just have to do something. So in itself, it's traumatizing.
The fact that every day is a struggle to find ways of managing and overcoming the cravings, and trying most of the time and failing to do so. Any other perspective that we can look at the two being connected?
Hello.
Yes, go ahead.
Yeah. My name is Cheriot.
Yes, Cheriot.
I think addiction and trauma. Trauma has been listed as one of those factors that actually leads to addiction because of the pain, the confusion, the psychological effects. It leads a person to begin self-medicating by actually getting into drugs or alcohol. Thank you.
So trauma being a cause for addiction, in the sense that people will use drugs or will engage in addictive behavior in order to numb the pain, in order to medicate the pain. All right. Any other perspective? Maybe Helen from the chats, and then we can look at what will be the focus of my presentation today.
Okay, thank you, Catherine. I also do think addiction and trauma have a relationship, and I think some of the consequences of addiction the behavior can make someone experience trauma. So I think there's a relationship there for sure. From the chat section, thank you for the feedback, everybody. Valentine says, yes, there's a connection because most people start taking substance to evade the real experiences and slowly get addicted. Brenda says this is a connection because one might use drugs and alcohol to numb the pain of trauma. On the other hand, being high on drugs exposes one to easily getting traumatized through violence, accidents, etc. Wanjiro, yes, a traumatized person numbs the pain using substances. Thank you. Anne says addiction may traumatize the immediate people, especially that the addict may overspend in drugs. Then more feedback, the connection and the family level, the fights, deaths, losses, etc. Mercy says, I think there's a connection. Some accidentally get addicted to the medication for physical trauma. Anastasia says drugs and substance. Agnes, trauma as a risk factor for substance abuse or use or abuse. Virginia, the behavior from the addiction causes the family members trauma. Florence, medications used to treat trauma can become addictive. Thank you.
All right, thank you everyone for the contribution. And as you shall see in my presentation and on some of the points that you have given, my focus today will be to look at the impact of both trauma and addiction on the brain, and then to look at the connection between the two. Just look at what are some of the statistics that show that there is a connection between, you know, addiction, sex addiction, addiction to drugs, addiction to gambling, and trauma. And then also look at advanced childhood experiences and see how that has contributed to addiction. And then have an overview of trauma-informed care. What do you need to do when you're working with clients with substance use disorders or with addiction, and may have a possibility of having been exposed to trauma during their time of use of substance. So just having to have a look at the definition and start looking at, I would adopt this definition of addiction, looking at addiction being a chronic relapsing condition which is characterized by the compulsive drug-seeking nature. Just maybe to underline or to point on the compulsivity of it, that lack of sense of control of seeking drugs and abuse, and the lasting chemical changes in the brain. And as you move forward, is just to check, does trauma do the same? Does it have compulsivity in terms of thoughts that we experience? Are there changes that take place in our brains as a result of being exposed to trauma? So that's the definition of addiction that we will be looking or working with. Then we look at the definition of trauma, and the definition that I will look at here for trauma is based on the Substance Abuse and Mental Health Services Administration, SAMHSA. And according to SAMHSA, trauma is a response resulting from an event or a series of events, because people can be re-traumatized, or a set of circumstances that is experienced by a person as physically or emotionally harmful or threatening, and that has lasting adverse effects on the person's functioning, both at a physical level, at a social level, at an emotional, or even their own spiritual well-being. And as we trauma, as we know it, there has to be an existence of an event that happened, that happens to a person. And then that event, when you combine it with the experience of the event, because it's possible that we can be exposed to the same event, but my reaction becomes totally different to the other person's reaction. And then now we combine with the effect that such experience has on a person, which equates to trauma, which translates to affecting their physical, their social, their emotional, and their spiritual well-being. Another focus of trauma using the PTSD or the post-traumatic stress disorder, looking at the diagnostic criteria for mental disorders, that is the DSM-5, I've left out the occurrence of the event, which is the #1 criteria that meets for it to be called a trauma. But then looking at the criteria that the main components that makes it be a trauma is when someone experiences persistent, effortful avoidance of distressing trauma-related stimuli after the event. So one of the characteristics is someone avoiding any triggers or any indications of what could remind them of the trauma. Then someone also experiencing intrusive symptoms, such as having intrusive, uncontrollable thoughts, nightmares, flashbacks that are related to the event, sometimes even having a vivid imagination of how event was or how it took place. Then having negative alterations in conditions and mood that are associated with the traumatic event. There are people sometimes when they remember about the event, or even uncontrollably, having persistent negative thoughts, or their mood becoming depressive and sad because of the association that they have with the traumatic event. And then lastly, alteration in the arousal. Either someone becomes hypervigilant or they become hyper-aroused, reacting to anything that is associated to the event. So they become easily startled, or they become very sensitive to any indications of the trauma. And for many people, there could most of us, we could have been exposed to trauma, but then again, we may not have paid much attention to it on the impact that it has on our lives. But the most striking symptoms or criteria that we may need to point out as we talk about trauma, those are some of the things to look at. And because we are looking at trauma and the connection between that and addiction, I'll just want to take a few minutes and explain my experience with trauma that led me to a few months of, substance use. And this happened back in 2011. This is the year that I lost my mom. And it was also the year that I lost my brother through a road accident. I'm not sure which was more traumatizing than the other, that the fact that he died through an accident, or when he died, he did not die on the spot because of the accident, but it's as a result of the accident that he died. So when he died, he was in the ICU for 10 days. The bill was crazy, about almost 4 million within those 10 days. Then he eventually died, and then we had to transfer his body from the hospital to Kenyatta University, because he was in Aga Khan. And when we were transferring his body, he wasn't in a casket. He was in a body bag, and there was where the face was, it was clear, and I was seated just next to where he was. And I don't know, that day there was crazy traffic, because I remember we left Aga Khan at 3, but as late as 7 p.m. we were somewhere around where we have Jubilee headquarters. So you can imagine spending all that time before getting to KU. That time we did not have the superhighway. Spending that time, so it was dark. It became dark eventually. So being stuck in traffic with a dead person, whom we were really, really close to, see him lying there next to me, and we couldn't talk. One of the causes of his accident is that he was intoxicated. And I remember eventually we managed to get to KU. We were getting there around 9 p.m. in the evening. But it has been such a long time. I think it took me about 6 years. And that image would vividly cross my mind. Every time I would use Thika Road, that would be the image. And if I would find myself having any business that I have to use, to go to Thika Road, I would really avoid going there. It so happened that I became very hypervigilant, and what my mind would constantly see would see hearses. I would just be walking and my mind would be able to quickly pick a hearse. So with time, because that happened in December, so Christmas was really affected. I remember New Year's Eve, we went out as a family, and I remember telling my sister-in-law and my brother-in-law, my husband was also with us, and I remember telling them that that day would be the day that I will drink for my brother. It will be the day that I will drink for my mom and anyone else that I loved, and they are gone and they have been drinking. And that for a while, for about 6 months, I would really drink a lot as a way of numbing the pain, forgetting, and having many questions. So my motherly responsibilities were somehow affected. And what is interesting, I think that was the time I was getting in the field of addiction, so did not know much about issues of addiction, the progression of it, how it affects women. But I remember meeting a friend who told me that he drinks, but the last thing that he would do would be to drink when he's sad, it'd be to drink when he's experiencing painful emotions. And that struck me, you know, and I took a step back and asked myself, so why am I drinking? And then, of course, it hit me, you know, trying to forget everything. Because besides that image of, you know, being in the same vehicle with a body next to me, I would also, you know, like replay his images while he was in the hospital, being in a life support machine and all those. So that was like the turning point for me to seek help. But most of the help, I think I did lots of cognitive work on myself. This is now where I sort of called myself, pale nyuma ya tent for a meeting, you know, to tell myself, what is it that I have been learning that can help other people? If I can't help myself, then what do I need to do? Do I need to go for more therapy? Do I need to, you know, work more on myself? So the long and short of it is just to show how that traumatic event for me was an entry. And there was very serious escalation within a period of 6 months. I would say I had moved from, you know, using at the socialization to a point of, you know, just drinking alone. I would leave work, go to class, then after class, I would go buy myself a drink and then come home, not even bother to check my kids. So that really escalated quite fast. And as I remember in the presentation that Susan Gita was giving about women and how addiction progresses with women, is that the concept of telescoping happens quite fast. The effects of alcohol and the effects of drug and use among women is quite fast. So that was my experience with trauma and you know, substance use. I was trying to numb and medicate, you know, trying to forget, but as time went by, it even became more difficult to forget. So we can now have a look at what trauma has on the brain, which translates both trauma and addiction, the changes that take place in the brain, which translates to some of the things that we see people who may be potentially traumatized experience. So we look at the impact of trauma in the brain. What normally happens when someone gets exposed to trauma is that there is usually a reduction in the higher level functioning of the brain, which is responsible for decision making, for judgment, for thinking, you know, sitting down and making a plan. It affects the prefrontal cortex. So the brain shifts from, you know, taking a step back and analyzing things to a survival mode. And that survival happens at whatever cost. And that's how you see some behaviors of people who have been traumatized or exposed to trauma. You know, it's more spontaneous than well thought out. So the brain is constantly hyper aroused, and this creates the need for something to slow it down, creates the need for someone to want to get safety. And that need for for slowing down or for getting into safety is if someone has an experience of using drugs, or if someone has experience of a certain behavioral addiction, that is where they will quickly run to, or finding a safety net in drugs. Trauma therefore makes the brain hyper-focused on the safety as a means of survival, whereas addictions makes the brain hyper-focused on the drug as a means of survival. Both of them, trauma and addiction, they have compulsivity. There is a sense of loss of control. So for trauma, someone is trying to survive, to find safety. But for addiction, someone is trying to survive because of the chemical, or because of the imbalances that are created, that the drug becomes pathologically wanted, that someone has created a new normal, and with the absence of the drugs, because of the pain of the withdrawal symptoms, then someone needs to use. One of the area that is responsive to trauma is the amygdala, located within the limbic system, which takes control and triggers our flight, our fight or freeze response. When our prefrontal cortex is working well, what one person or a person is able to do is that they can face the adversity that they are experiencing. But because of the traumatic experience, the person will either fight, and the fighting is a way of seeking safety, which is responsive, emotionally responsive, or flight or freeze. The memories of trauma get trapped, and they continue to trigger fear even long after the experience has gone. The same case when you're looking at when someone has taken drug, the pathway in which psychoactive substances or drugs take. One of the areas that gets touched or gets affected is the memory, and that is how someone is able to remember when I'm feeling stressed, or when I'm too anxious, when I'm having insomnia and I get to use this drug, then I'm able to relax. So the same case, the memories of trauma get trapped, and we are constantly in remembrance through the intrusive thoughts of the effects that trauma we constantly experience intrusive thoughts based on what trauma made us feel. This therefore results to limited high-level brain functioning activity into a survival mode. And just like trauma, addiction reduces the brain function to focusing on survival, and this is the reason as to why drugs become pathologically wanted. So for drugs is about survival, and for trauma is about safety. So both of them, they become entwined in a very complex manner for a person who is suffering from trauma and addiction. So the complexity of it, they somehow meet at one point that for addiction, it may have been triggered by trauma, but then again, once it develops to addiction, it becomes another complex thing. Exposure to trauma, a point to note when you're looking at the impact of trauma on the brain, is important to note. If people get exposed to trauma when they are young, it becomes like fighting without a weapon. Why? Because the high-level functioning or the prefrontal cortex of the brain is still neutral, learning small things has not developed the high processing ability that is needed for us to make sense when we get exposed to traumatic situation, and therefore that becomes overwhelming for children. And that is why you may find people as adults who engage in addictive behaviors, including substance use. But if you take steps back to find what happened in their childhood, you find there is so much trauma that they went through, but because their young minds or their young brains did not have the capacity to process, then use of substances or use of drugs become a way of medicating pain that happened in the past. Because the amygdala is basically in charge, remember we said that the amygdala comes in for flight or for freezing or for fighting. It can lead to behaviors that are spontaneous and impulsive, which some of those behaviors can be addiction. After trauma, decisions of life or decisions that we make become about avoiding discomfort, finding safety, even if it's a false sense of safety. And this creates a very fertile ground for addiction to creep in which, again, when addiction comes in, it's a creation of a false sense of survival. Like when you drink away your problems, once that alcohol wears off from you, tomorrow that alcohol is still going to be there. With the hyperarousal as a result of the trauma, the mind stress threat response becomes altered, and someone moves to a mode of feeling like they are going crazy, even when the threat is not proportionate to the response, like experiencing panic attack. And because of this constant feeling, because of being hyper-aroused, because of not being able to calm down, then it becomes exhausting for anyone. And definitely someone feels they will need to find something to calm themselves, or to medicate, or to take away those negative feelings and emotion. And of course, this fuels addiction through the concept of self-medication hypothesis, when people are saying people take drugs as a way of medicating, as a way of numbing the trauma. So that is how trauma affects or the impact that trauma has on the brain, putting the amygdala on high alert, slowing down the prefrontal cortex, and creating a memory of the effect of trauma, which translates to the responses, people having constant remembrance of the effect of the trauma, and of course, the behavior that we see as a result. So looking at this image, connection between addiction and trauma. If we are to look at some of the behaviors, that, or some of the signs and symptoms of someone who has been exposed to trauma, and then we look at some of the signs and symptoms of someone with an addiction problem, you will find that they will overlap. As a result of using substances, someone may develop anxiety as a result of having a PTSD or trauma. Then there will be anxiety as a result of substances. Someone may experience insomnia. So it's an all combination of factors that have very common similarities. So I want us to look at early childhood experiences, mention a bit about trauma and women, and mention what is important for us to do when you are working with people with substance use disorder or addiction in connection to trauma. And this to support with a study that was conducted on the impact of exposure to childhood maltreatment on transitions to alcohol dependence in women and men, showed the following results: that more than half of all the women seeking treatment for substance use disorder report at least one lifetime trauma experience. And then probably at this point, I may ask, what are some of the forms of trauma that women experience, and possibly women with addiction or women with substance use disorders may be exposed to? What are some of the traumatic risks that women get exposed to? And even further, what are some of the traumatic risks that women with substance use disorder get exposed to? Anybody?
Hi, Catherine, you want us to respond?
Yes.
Okay, and I think it's a good break. We are learning a lot. I was saying, this is a lot of information. Thank you for giving us the break. I keep hearing the brain being mentioned. So yes, people, what are some of the risks? Catherine, come again with the question.
What are some of the risks, or what are some of the traumatic experiences that women get exposed to? And if you are to look again at women with substance use disorder, women with addiction problem, what are some of the traumatic encounters they may have? And because they are addicted, they may not even be aware that that was a form of trauma.
Thank you, Catherine. That is also reminding me, we somehow covered that when we had Susan Gitao's session on women addiction. So it's like a revision or a sitting cut for those of us who are many who are here for that session. We somehow mentioned some of those things. So let's hear from us, our feedback on the same. Yes.
It's a good way to check whether learning took place.
I know, and I have been wondering whether learning is taking place. If there's no learning, we'll take a break. We go and first read the notes we have. So yes, people, I see the people who are here on time and very early. Maureen, you there. Alpina, Anastasia, Brenda, don't mention because I know you have the answer your fingertip. Venus, is your hand is raised. Go ahead.
Sorry, I just wanted to respond to your question. on what women face in terms of experiences, and maybe share my own experience. I did go through a miscarriage, and I realized that in one way or the other, after seeing a psychiatrist, I became like very dependent on the medication. So that's another thing that I've realized even in the field of addiction, whereby once you're given the medication for depression, it can easily have you hooked.
Mm-hmm. So the medication that are given for management of trauma can make someone become dependent on it, which is another, entwinement with addiction. Thank you so much, Venus, for sharing your story. I've seen someone who is saying I increased the volume. I'm trying to figure out where to.
Was it mine or yours? I'm also seeing Oirimo and your hand is raised. Go ahead, Oirimo. Oirimo.
I'm unmuting, sorry. Yeah,
Yes.
Good evening, everyone. Yeah, I believe that women who are going through addiction are more prone to be sexually abused by their partner, or even people that have been out indulging in alcohol or drugs. And this can even be done without their knowledge that they're actually being abused, because already their cognition is not at par. So it's easy for them to be easily taken advantage of.
And the reason as to why I'm asking, women getting exposed to all these kind of traumatic events is because in addiction treatment, most of the time we tend to ignore that very crucial fact. What other forms of trauma do women experience? I'm not saying men with addiction do not really experience that forms of trauma, but just looking at
sorry.
special interest to women. Yes.
Hello. My name is Cheriot.
Yes, Cheriot.
I'm still following. Somebody had mentioned miscarriage.
Yes.
I also want to relate to infertility. I also want to relate to sudden infant death. And I want to bring in lack of management, proper management of grief, because sometimes some of these things are not taken by people as a real loss, particularly in some communities. So you find this person struggling alone, and I'm bringing in what you call the disenfranchised grief that is not validated, that is not accepted, kind of. And so the person struggle alone, and they end up now again getting into some of these drugs to be able to numb, the issues they are going through.
So because of the challenges that they experience, with children, infertility, losing children, and what the society expects, you're supposed to move on like nothing happened. And then because they don't want also to be seen, women tend to be, closet drinkers, hiding behind the closets and using, because there's so much stigma and labeling around the women that use drugs. So that even makes their progression to addiction very fast. Maybe we can hear from one last person and then I can move on with the presentation. Yes.
Hello.
Hello, go ahead.
Okay, maybe I can share.
Yes.
Yes. Regarding the women, there is that loss of dignity because the society labels a woman like somebody who should not do such. Like in Africa, alcohol and drug and substance abuse is socially, like almost in quotes, socially accepted by the community for the men. But when a woman is seen going into drinking, they are labeled, and therefore they feel like somebody was lost their dignity. There is a lot of labeling. There is a lot of stigma that is associated with them, and almost you are like a social outcast. And because of that, they will go into they will go into hiding, whereby they feel, I want to be they almost feel like I just want to be alone. I don't want to be with somebody. And this one can even cause them to go deep down into depression because they don't get a support system. Unfortunately, even their own women, they will still not support them because there is a lot of judgment that is related to a woman who is drinking or a woman who is in alcohol. There is a lot of that judgment makes somebody self-judged, and they feel like they're losing it, especially being treated like a social outcast as opposed to being supported for the sake of, getting that support. It's not easy. You're treated like you're pretending. It's like a pretense, and you're not given such support, and you're labeled, and you become like somebody who is not needed in the society. And that one really complicates things, and it can let people go to depression. Thank you.
Thank you so much. Stigma, labeling, loss of dignity, and addiction is one of those diseases that robs people of dignity because of what happens. Even more so when you're a woman. A woman is expected to be in a certain place in society. So even coming out or finding support system becomes very difficult. So it's like as men working in their recovery, women have to work twice as hard because of what culture expects them, what the society expects them to do. Right, I think we can continue and look at the different types of addictions and how they are connected to trauma. Again, another important area that I feel like I still want to make emphasis on is on childhood maltreatment. So from this study again, childhood maltreatment leads to initiation of drinking earlier than those who were not exposed to such kind of maltreatment. And women who experience childhood maltreatment have a shorter time period between drinking onset and alcohol dependence. We shall pay a bit more attention on the early childhood experiences, like you saw in the beginning of what I'll focus on is on the ACEs, and just look at what are some of those early advanced childhood experiences that when people get exposed to not only addiction, other problems that develop. And unfortunately, some of these experiences, they go undetected, they go untreated. And we get to wonder why people experience some certain problems. Then that study also showed that people who abuse substances and have experienced trauma have worse treatment outcomes than those without trauma histories. So for those people who have been through trauma, their recovery becomes complex. And this could be one of the explanation as to why people will go through treatment programs, and if that trauma was not touched, that the chances of relapse increases. They also show that trauma is associated with a higher risk of later substance use, and substance use predisposes people to higher rates of trauma. Like I remember in the beginning, someone mentioned that when you are using substances, you are exposed to trauma, and because of trauma, you also have a high likelihood of developing substance use disorder or having an addiction problem. So what that means is that it is very important and crucial to assess for trauma for women seeking treatment for addiction. And when there's a course on clinical care for women with substance use disorder, and trauma is one of the big factor. And from experience with some of the women that I've worked with, someone has gone for treatment 3-4 times, and they will constantly relapse. They did not even understand themselves why they were relapsing until in one treatment facility, they get someone who touches on that trauma. And now the work of their relapse becomes on addressing that trauma, and they starts to have success stories of their recovery. Then also another important element is that there is need in addiction treatment to assess for adverse childhood experiences for adults that are seeking treatment for substance use disorder. And the adverse childhood experiences, they are those experiences that people are exposed to between the ages of 0 to 17 years. We shall look at the ACEs later in the presentation. And then it also calls for need for comprehensive case management, because trauma complicates recovery. Means that there's a lot of work that needs to be done with the person with substance use disorder or with addiction as a result of their trauma. So let's have a look at, you know, some of the combination of some of the statistics that have come up when it comes to looking at trauma and addictions. And we look at sex addiction. Sexual abuse can create unhealthy sexual development in people. Children get exposed to sexual molestation while they are young. I remember the other day reading a story of a gentleman who was molested at the age of 10, and that really affected their sexual identity. Trauma survivors can often recreate the sexual events that traumatized them. And by recreating the sexual events, it's trying to find a position where they can put themselves in a position of power, a position of authority, like it is a situation that it puts them in having a sense of control. Because being exposed to, you know, sexual abuse, rape and assault, you're powerless. So recreating the events and becoming the dominant, then it's an unhealthy way of coping. So that's some of the behaviors that are characteristic of sex addiction. And I don't know, there used to be this movie that was banned, but there was a book of, it's fictitious, but it really talks about the recreation of sexual trauma. 50 Shades of Grey. The key person in the story is developed, you know, some form of sexual deviance by finding a way in which he can become a dominant, in which he can become an authority, as a way of, you know, finding ways of overcoming what he could not defend himself when he was abused. Then that means that because of the trauma, someone finds themselves engaging in a cycle of self-destructive behaviors, which are triggered by emotional discomfort, such as anger, such as shame, such as fear and guilt. And of course, that takes the person to engage in the behavior again. Again, looking at gambling and PTSD, and a study that was done to look at the symptoms, PTSD symptoms in pathological gambling, showed that 34% of people who had gambling problems also had PTSD. So that again is telling us, when you're looking at addictive behaviors, not just substances, there's need to check a possibility of an underlying trauma. People with gambling problems who had PTSD were found to be more likely to experience problems such as anxiety, depression, substance use, impulsivity, that may have even led them to having a suicidal attempts. People with PTSD are more likely to gamble to to escape from the problems or the symptoms of PTSD. So again, showing another correlation between the two. Then looking at PTSD among our soldiers, looking at PTSD among, the uniformed forces, people who get exposed to war zones or in combat. So PTSD among soldiers is said to generally occur as a result of, witnesses, things during combat, such as explosions, gunfire, fighting, when you see bodies of people, when you find yourself in the front line and fighting an enemy, and then seeing your colleagues die or seeing other people die, then that in itself is a form of trauma. Therefore, consumption of alcohol, when introduced, tends to prolong and intensify, because people will consume alcohol as a way of self-medicating. So what this will do is prolonging the PTSD, because the person does not have the opportunity to heal from it or process it, which then intensifies the symptoms, such as, insomnia, such as depression, such as anxiety, further complicating it. And one of the explanations as to why that may happen is because alcohol lowers the chemical in our brain, serotonin, which affects our sleeping patterns, affects our sense of remaining calm, the mood and appetite and memory. And then also again affects the stress chemical that controls our reaction to situation. So meeting again the criteria that we saw for trauma. And because the person is now experiencing insomnia, because the person is experiencing heightened anxiety, then they go back to using alcohol to numb the same. And this complex cycle of, PTSD and drug use leads to them having increased risk of suicide, increased risk of homicide. That's why you hear someone turn a gun on themselves. They ended up killing their family members because they never got a chance, to process that. And just having a closer look at some of the experiences that our own Kenyan soldiers have experienced. And I know most of us may be knowing Lucy Mukuria. She's been very vocal about PTSD among the KDF or among the army. She's currently retired. Herself, and this started from her own experience, and like he shared, she doesn't have a sense of taste because of seeing bodies piled after El Alde, where most of her colleagues were killed. And then also, according to Iregi Mwenja, he's again another mental health advocate, but he's also an ex-soldier who has the Psychiatric Disability Organization of Kenya. From their experience, Lucy Mukuria has worked with over 800 soldiers. And from their experience, they have found that substance abuse and suicide have been very rife among those that they have treated, or they knew and have described in painful detail how PTSD has ruined their families and has sparked violent outbursts when it has gone untreated. Unfortunately, when start to look at matters, defense forces, they have their own way of doing things. And I remember reading a story of a soldier who was jailed for 2 terms and further even jailed for another 6 months. Reason because after when they were in Somalia, and the camp where they were blown up by Al-Shabaab, and for 2 weeks, all he could hear were people killing each other, those intrusive thoughts that you're talking about. So it's like he temporarily went crazy. And what the court-martial ruled was that he absconded duty, so that led to him being imprisoned and such. I think that becomes another, maybe not this forum for debating about issues of trauma among the defense forces and it going untreated. By the way, what does the current task force report, what does it say about mental health when it comes to the uniformed forces? Is there anything on it? I've not had a chance to look at it. Is there anyone who has had a chance to look at the mental health task force report and what it is saying about mental health in the uniformed forces? Anybody who has had a look at it?
Hi, Catherine.
Hi.
I have skimmed through the report.
Uh-huh.
Skimmed means I haven't literally gone into the details. But I think one, it's a good question, and even number two, I think we need to have time to discuss as a professional what the report says and look deeply into it.
All right.
I'm answering my own question, I think, to help all of us who haven't looked into it to go look into it.
Okay.
We have Jacinta Kakucha. I think she's the one.
Okay. Hello. Is that related to what you're talking about? Hello. All right, like Helena said, I think it's throwing us a challenge to just skim through it. And as we agitate, for mental health, it cuts across our population, and looking at trauma and knowing some populations are more exposed to trauma than not, because the soldiers are our brothers, they are our fathers, they are our children. So it's also important to check and see whether there is something for them and how that can be addressed. Another perspective of looking at trauma is and the correlation between trauma and addiction. So that was just identifying some different forms of addiction and trauma. Then looking at trauma, addiction, and prescription medication. And I remember there's one person who said that when she went to the psychiatrist and she was given medication, you know, just again developing dependence on the same. And there was a study that was conducted to establish the role of traumatic event history in use of non-medical use of prescription drug among adolescents, which found that lifetime history of delinquent behavior and other forms of substance abuse, and history of witness violence and history of PTSD was significantly associated with the increased likelihood of non-medical use of prescription drugs or medication. And you know, the question that I had there was, you know, so if you're looking at a traumatic event occurring to the person, then being prescribed pain management medication or medication for managing their anxiety, and because someone has had experience of what that medication is doing to them, then becoming dependent to the prescription drugs. You know, checking people who have had severe pain, you know, and possible dependent, and this happens on possible dependent on opioid medications. Then on attachment theory and intergenerational trauma, attachment and relationships with children's or a child primary caregivers in the earliest years of life really play a primary role in organizing the child's response to fear and threat, and the child's ability to, one, regulate their feelings, to regulate the expression of emotion, their sense of worth, love, and care, also to feel free to explore the world around them, and then to learn accurately, or rather to be able to accurately appraise and cope with risks when they are exposed to it. Of course, the opposite is true. If a child is not in a safe environment, then their ability to express emotions becomes affected. You know, being in a situation that someone cannot talk about how they are feeling, not knowing how to express love or caring for other people, not being fearful of exploring the world around them, and finding it difficult to be resilient or to cope with situations when they present. Our response to relationships, according to attachment theory, is based on attachments. Either we form secure attachments, and secure attachment is when we can, feel safe with people. It's when we can feel safe with ourselves, is when we can be independent in forming relationships, be able to individuate. Then also people can develop avoidant kind of attachments, that someone is really disengaged, or become ambivalent by being both anxious and resistant, failing to connect with people that surround us. And this, depending on which form of attachment, this you can read further on attachment theories by both Bowlby and Ainsworth. When we don't have secure attachment, then that can be self-destructive. When we have avoidant or anxious, resistant kind of attachment, then that may result to someone engaging in self-destructive behaviors because they cannot self-regulate. So when trauma, now touching on the intergenerational trauma, when trauma wounds transcend generational gaps, this fosters perpetuation of coping skills. So if someone saw their mother, coping and dealing with being battered by their father through drinking, there's a high likelihood that the same coping mechanisms that someone started with would be the same coping mechanisms that someone would use. So including substance use and other impulsive behaviors, and these will form entry to drug use, and as well as perpetuating and maintaining addiction. So now having a look at advanced childhood experiences, this I think is an area that I feel most of us in the mental health field, as we look at various psychological disturbances, various other conditions, is really important to look at the advanced childhood experiences. And there was a study that, that was done in depth and was able to come out with shocking reports on some of the mental conditions that we see in adults being linked to advanced childhood experiences. So the ACEs are linked to chronic health problems, mental illness, and substance use in adulthood. This was from the study that was done, and they also showed that they can negatively impact education and job opportunities for people. People doubting themselves, people not wanting to take risks because they are looking at where they feel safe. Those who experience trauma in their early years often develop survival mechanisms that are less than helpful in adulthood, such as addiction. So some of the forms of advanced childhood experiences, and probably, majority of us have been exposed to this, but we may not look at them as a form of trauma. It's abuse, which can either be physical, emotional, sexual, or even neglect. Exposure to parental violence, when there is household dysfunction of parents with an altered, untreated mental health conditions, or even substance use disorder. Having parental separation or divorce, loss of a parent through death, either being deported, incarcerated, or being removed from the family home in case of someone was put in a foster care. So those are some of the advanced early childhood experiences that may have an effect on adult mental state of a person. So those stressful experiences in childhood may stem from the family, or even outside the family. Bullying, witnessing violence, being an immigrant, or being a refugee, being homeless, living in a war zone, among others. Like with the COVID situation, children are being exposed to these adverse childhood experiences. The other day, I remember seeing a clip of a family being thrown out of their house because the parents cannot pay for rent. And basically, forms of molestation and abuse that are taking place, those are ACEs. Understanding these underlying issues, for instance, becomes very instrumental in unlocking the secrets of addiction recovery. And the findings, this done from participants, about 17,000. This is a study that was done way back between 1995 and 1997. You can look at those studies from CDC, and the ACEs questionnaire that I would encourage, as we work with different conditions that we can assess, contains 10 questions. And from this study, it shows that we can look at now within the context of substance use. If someone has an ACE score of 4, so out of the 10 questions, if they have an ACE score of 10, they have nearly as double risk of developing cancer or heart disease than someone with without an advanced childhood experience. Then developing an alcohol use disorder increases 7 times when they have an ACE score of 4. And the likelihood of suicide, again, increasing about 12 times. So this just shows that ignored impact of our early childhood experiences to traumatic events may have to our present day functioning, which we may go unassessed or undetected or untreated. So people with the higher ACE scores are likely to experience chronic pain and misuse prescription medication, and are at an increased risk of serious health conditions such as heart disease, cancer, depression, substance use, liver or lung disease, stroke, or diabetes. Like I've said, is a study that we can go look at, and raising awareness, which is what I'm doing as I talk to you here, is that we can change how people think about the causes of ACEs and how and what we can do to prevent them. Because if we prevent exposure to those adverse childhood experiences, then we will be managing possible trauma and managing other complex issues that people could be struggling. Then being able to shift focus from individual responsibility to community responsibility, because these do not happen in isolation. So having a communal responsibility in protecting children, in protecting young people, very important. Then to reduce stigma around those seeking help with parenting challenges for substance misuse, depression, or suicidal thoughts, because it's clearly not their fault, it's from the experiences that they went through, that it is okay to talk about what happened and allowing the space for people to be listened. When people feel it's okay to talk about it, it first starts by reducing the self-stigma. And as many voices speak, then the society listens and then interventions happen. Then promoting self-stable nurturing, relationships and environments where children live, learn, and play. So as we work with children who has been exposed to such kinds of traumatic experiences, it's not all lost. We need to focus on transforming those troubled children to tomorrow's heroes, to building resilience, building mental stamina that they can face adversity, but of course being there to protect them. I have about 3 or 4 slides to go. I want to look at this quickly first, but before I do it, I don't know whether there's any person who has a question or a concern.
Thank you, Catherine. So far we are learning a lot. And I also want to, I've seen people saying, wow, awesome presentation, awesome content. That's how people start winding up. So please don't wind up before we have officially. I have some really good news at the end of this presentation. So please let us stick to the very end for this presentation. It's Friday, it's the last one for this week. Yes.
Oh, I forgot it. It's Friday, and Friday we have plans. I'm actually winding up, just looking at, because the focus was just for us to see the connection between the two, just highlighting what we need to do and what it means to have trauma-informed care. When one of the goals would be to shift reliance on those survival instincts to healing, and for someone developing better coping skills, that they can be in the present, that they can make meaning of what happened, and that will not lead them to them acting on impulse, but to have a sense of control. And this can be through using guided imagery, mindfulness, CBT, EMDR, among others. Then, of course, self-regulation, teaching people how to learn self-regulation, a sense of control, take a moment, pause before acting, regaining personal power through self-control and success. And this, it's something that someone has to learn through experience, trying out things. So what does it mean when you talk about trauma-informed care? Trauma-informed care is when we work with people who have been affected by trauma, that we need to look at these core values. Very important. We need to make the person who has been exposed to trauma to feel safe. We need to create an environment of trust, protecting their confidentiality. We need also to respect their autonomy of what they can talk, the decisions that they will take, but then also appreciating that it's a collaboration between you and them to work for them to be able to deal with the trauma, and empowering them to cope with the trauma, empowering them to speak about the trauma, empowering them to learn ways in which they can deal with the trauma. When it's we're working with people with substance use disorder, trauma-informed care involves educating the persons with the substance use disorder about SUD and the potential impact it may have on their addiction and consequent recovery. Then also educating them the cognitive impact of trauma, how trauma may have affected their thinking, the view of themselves, the view of the world, and basically the schemas that they form about themselves and about the world and about situations. Then teach them about triggers and how to cope with triggers, and then most importantly, avoid re-traumatizing people. So some of the things that you can teach on educating someone about trauma there. Yes. So I think I want to take a pause here on what to tell people with addiction and also trauma, on how we can help them on trauma-informed care. And a parting shot that I want to leave everyone exploring is, what are some of the ways in which, in the spirit of helping, because as helpers, we may be coming from a good place, what are some of the things that we can do in therapy that may end up re-traumatizing our client, making it worse?